Good morning, everyone. It's Thursday, December 30th. Of course, we are not actually here live today. We have recorded this intro to one of our very favorite episodes for you to enjoy while we are spending time with our families. We've got an exciting show, but I first have to ask Dr. Hawkinson about his cat pizza. What's happening? What's going on?
I mean, it's a smorgasbord of just fun things.
Very festive, very
Pizza,
Christmassy.
cats.
And you love cats so much.
Santa Claus hats.
And I hear you like to change kitty litter.
Yeah.
Yeah.
As an infectious disease physician, I do not change cat litter.
Okay,
Sorry.
good to know. All right, good shirt. Okay, so we've got this great show for you today. So imagine you or your child needs a life-saving treatment, but the nearest place offering it is 500 miles away. I mean, what do you do?
That's a long ways. And in just a few short months, you won't have to leave the metro area to receive a leading-edge cancer treatment called Proton Therapy. We are putting the final touches on this amazing technology right now. We even constructed a new building from the ground up to house it.
And today we want to take you back about 3 months to one of the proudest days at our health system, the day the new Proton Therapy Center was dedicated. We also got to watch as a time capsule was buried live on our morning medical update. You'll see what people who dig it up in 30 years will find inside.
Yes, that was a very cool episode. So we hope you enjoyed this ENCORE presentation, and we will see you back here live on Monday, January 3rd. And are you singing us another song?
COVID got run over by a reindeer. Vaccine was riding on the sleigh. Yeah!
Okay. Happy holidays, everyone. Good morning. It is Monday, September 13th. We are live inside the Dolph Simons Family Jr. broadcast studio. Welcome to the Morning Medical Update. Today we are talking COVID with Vice Chancellor and Director of the University of Kansas Cancer Center, Dr. Roy Jensen. And of course in studio, right here next to me, Chief Medical Officer, Dr. Steve Steins. How are you both doing?
Good deal.
Do I dare ask? Of course you're doing well, because Chiefs football is back.
That was awesome.
With the first win. You said you're a little hoarse today.
I may be a little hoarse. I may have taken too much ivermectin. Just kidding. I'm not a horse. I may have been a little hoarse from yelling at the football game yesterday. And so I went there. When I was inside, I wore my mask. Outside, I tried to wear a mask. I started sweating all the way through it, which wrecks your mask. I took it off. The breeze was gone. I felt safe. And then got back ready to go inside again or under the concourse, and in the really thick crowds walking around, I put my mask back on. So,
Dr. Jensen, I walked in this morning. I said, "Good morning. How you doing?" You said, "Chiefs won. How much better could I be?"
Not going to complain.
Right. All right. So people are already asking what your thoughts are about now that football's back, combining football and COVID.
You know, I'll tell you, I think I go to the Lollapalooza data that if people are outside, things go pretty well. Most events outside go pretty well. Sturgis looks like it's not the outside part, it was the inside bar and restaurant thing. And so I think, and the Royals games, Royals games have not produced a big COVID outbreak. And I think it's sporting, same thing, no big COVID outbreak. And, people are kind of close together and screaming at a sporting game. And I think that's going to be the answer. I think that outside is just different because of the dynamic from all the air, and I think inside is just
no problem.
I've got somebody talking in my ear. Sorry. Okay. Thank you for that. I want to let everyone know we're going to try to get outside of the Proton Beam Therapy Center. We're going to be burying a time capsule today. Did you hear about that?
I've heard a little bit.
Of some rumblings about this very cool thing that we're doing. So we are trying to get outside to do that live here in just a moment. So stick with us. But let's get to Dr. Dana Hawkinson.
Yeah.
How's your weekend?
The weekend was good.
Good.
The weekend was good. Was watching the numbers here, and luckily we have seen a decrease over the past week of our total acute hospitalized patients. So right now we have 40 active infections with 13 in the ICU and 8 on the ventilator. We should note that 7 of those total 40 infections, active infections, are fully vaccinated. So, but again, we have seen, and I don't have the direct data right now, but we have seen historically through this, since we've been giving those numbers, that those vaccinated people are really those people with high comorbidities and with immunosuppression, as we do have a lot of those populations here that we serve at the health system. So also Hayes has 13 total patients with 6 active and 7 in that recovery period as well. We have 42 additional in that recovery period, but a total of 82 less, quite a bit down from that 100 that we saw last week.
Yeah, we peaked at 107, and now we're down to 82, which is tracking, I think, across the area with other places. Yeah. In fairness, we were really full all weekend, and we just didn't take transfers. So I think, again, this is the struggle with comparing this year to last year, is that last year we had more beds and more flexibility. Now, after a year of COVID, our staffing's tighter. we can't take, and everything else is open and people are sick. There's a lot of RSV. Our peds ICU is full, and so I think what it's telling us is that we would have more if we could have taken in more transfer center patients. But the simple reality is the numbers are also declining across Kansas City. So I think that's a really good sign. So I'm hoping that the fourth wave is going to come it'll begin to ebb. I think that what we have to be careful of is that last year in September and October, as schools reopened, we clearly saw an upswing in the numbers. And what we have to be careful of this year is the same phenomena, coupled with what could happen when people go back inside again in November and December and maybe some of October. So those two effects are the things we have to be careful with. What we hope is that enough people have been vaccinated against it. There are people who obviously have had it, and that will protect us against what would be a difficult fifth wave, I think.
All right. Okay, so we're going to get to some community questions in a moment, but let's get to some reporter questions. Do we have any on the line today? Okay, I do have a reporter question from Channel 9. Cody has a question and wants to know what our doctors think about this. So maybe many people heard that the Olathe East football coach passed away from COVID, 34 years old. He was not vaccinated against COVID. His parents are now urging people to get their shot. The coach had considered getting the vaccine but was still on the fence. Just wanting to know your thoughts on that situation. What is your message to the public for the people who are still holding out? They are still waiting.
Yeah, that stuff. So first of all, hearts and prayers out to the family of this 34-year-old football coach, and that that's the heartbreaker. And unfortunately, we've seen that repeated a lot in people who are unvaccinated. Hawk gave the stats. We have 7 people out of 40 who have been vaccinated that are hospitalized. But if you look at our deaths, it's 98.2% in the unvaccinated population. It's just overwhelming. And the numbers of people who are dying that are vaccinated, those patients are all horribly immunosuppressed, either because they're an organ transplant person or they're actively getting chemotherapy or something similar to that. So at the end of the day, we just have a decision to make, and unfortunately, thinking about getting vaccinated does not offer protection against COVID-19. It's having to complete the 2 injections. And the data is overwhelmingly clear that there are 3 great choices out there. If you're really afraid of needles, you just don't want to take a chance, and just go get your 1 shot of J&J. It's not quite as good as getting, to a Pfizer, or evidence is mounting to a Moderna. Looks really good, but all of them are really great at preventing severe illness and death, Hawkeye, and I think that's got to be the message to everybody. Take this and learn from it. And I so appreciate what the family's trying to say is, folks, don't hesitate. You don't want to be, and you don't want to put your family and your loved ones in this position.
Yeah, I mean, this is an absolute tragedy, 100% preventable tragedy. And when we know how he was making difference in the lives of young people, and that is so important now. And if we take any glimmer of hope or sliver of light from this, maybe those people will see what happened, those young people who are hesitant to get the vaccine, or their families, and talk to their families and get the vaccine now after seeing that. So if we can take a little bit of a glimmer of hope, but it is such a tragedy. He was working with the young people, he was going to school, he was studying, he was doing all these positive things, and now those young people, particularly on that football team, have one less mentor and good influence to look up to now.
So go get vaccinated.
Yep.
All right, well, let's turn to our in-studio guest, Dr. Roy Jensen. So you have a new title, so congratulations, by the way, being named Vice Chancellor.
Thank you.
So I want to talk to you a little bit about what we've been talking about over the last year and a half, which is people delaying their cancer screenings and therefore people having more advanced cancers as they're coming back in to see their providers. Are we catching up on those screenings? Where are we at as far as making sure people are getting the health care they need?
Sure. Well, we have our own Ron Chen to thank for helping quantify the tremendous loss of screening that we saw back a few months ago in kind of the throes of COVID. And I would say that overall our screening has kind of gotten back up to where it was, but we haven't seen any additional screening. So it's like, I think most of those folks that chose not to get screened have not gotten back into the system. And there was some data that was just published in JAMA within the last week. Actually, a study coming out of France showing that for colon cancer patients that were diagnosed prior to COVID and during COVID, their biomarkers showing metastatic disease were much higher in the COVID era. So I think that what that's suggesting is that it's causing people to be diagnosed at a much later stage than what it was before
So
COVID.
if they miss their screening by like a week, they're not getting in. They're waiting
well,
that whole
yeah.
year to come back.
Yeah.
So what's your advice for cancer patients and the booster shot? We get a lot of questions about that, if they should, when they should.
Sure.
What's your advice?
So I think, not all cancer patients are the same, and I think we have to be particularly cautious around hematologic malignancy patients, in the timing of their vaccine, making sure that they have sufficient white blood cells to kind of have an effective vaccine, and our folks here, can help with making those decisions. I think in large part for other folks, adhering to the recommendations around getting a booster, 6 to 8 months out is the best way to handle this. And Dr. Hawkinson and I were talking earlier about the fact that delay period, it's not just getting a third vaccine boost, it's the timing. Mm-hmm. And because that dramatically impacts kind of the impact that it has in the immune system. So, we're still learning a lot about how to make sure to have the best immune response against this disease, but it looks like that 6 to 8 month window it certainly boosts the effectiveness.
All right, so don't miss the booster. Okay, so we've got another TV guy sitting here, Dr. Steins. Dr. Jensen, want to talk about a little bit about bench to bedside. How many seasons has it been going, guys? What is it, 7, 8?
I think it's 8.
8, okay.
Yeah.
8.
So 8. Okay, that's a hard 8. Okay, that's a lot. So this is a podcast.
The voice of God said 8, so.
The voice of God coming into the studio as usual. So this is a podcast, again, called Bench to Bedside, focuses on cancer from the research bench all the way to the patient's bedside. So you recently, I think on the last episode, talked about the effects of cancer patients and COVID. And then we had some questions come in after that. So we're going to kind of do a little continuation, if you don't mind, of your
Sure.
show and ask a few questions. Okay, so Kathy wanted to know, she wants to know how soon can she get the booster after the vaccine, which we talked about, but she had both Pfizer vaccine doses and is on that, what's the word? Anastrozole. I said you're going to have to help me through that one. I don't know those big words. So on what you were just talking about with the booster, she's on this additional medication. Will that affect her booster or when she should get it?
Anastrozole should not impact your response to the booster vaccine. So I don't think I would worry about that. As long as your white counts are where they need to be, I think you'll do just fine.
Okay, so Fanny had a question. You were doing some myth busting, but she may have missed this one. She wrote in and said that a friend who works in a nursing home who was against the vaccine for fear it causes infertility. What would you say to that friend?
Yeah. Well, we've already talked about the unfortunate incident with the Olathe East football coach, and what I would love is to understand what were the influences on him that led him to choose not to get a vaccine. And here we have an example of someone who's probably listening to something on the internet, and clearly someone who frankly doesn't know what they're talking about. The vaccines work; they're effective. They're an extraordinarily effective measure to prevent death and serious hospitalization, and really almost everyone without exception should be getting this vaccine.
That question keeps coming up a lot, the infertility question. Still, why is that?
It's this minstrel thing, although they announced, I think, yesterday or so that the NIH is going to sponsor a site looking at menstrual changes post-vaccination at 5 places, in Michigan State, Oregon, Hopkins, I can't remember the rest. But it'll be a study, but it's going to be a years-long study, so we won't know the answer for quite a while about whether or not there is an impact on on the menstrual cycle of women. Have you seen much about that, Hawk?
I haven't. But we should mention, too, that this misinformation about infertility did not come about because of any adverse events or anything of that nature. It was a single post on a social media that was not backed at all by science or informed opinion even. And it has been really ruled out. And all the OB-GYN societies, medical societies, do recommend that those people who want to get pregnant and or are pregnant and breastfeeding should be getting the vaccine.
Yeah, and I think, even the question on menstrual irregularity or changes, you have to remember those happen in the background with folks. So the question, without vaccination, the question is, it actually increased? Well, we're seeing a lot of people blame changes in whatever part of their body that happened because they got vaccinated. But when you step back and look at the data, all these things happen in a normal daily basis across the world. And so the question really is there an increased incidence once people have been vaccinated, and when we trace that to vaccination or any other change in habits? And so we don't know the answer to that yet. What we can say to you is that there is no question that COVID causes a whole lot of changes in your life. And I was listening this morning, I was driving in on a report from someone who had post-COVID syndrome or long haul syndrome, and the impact that's had on their lives. So the reality is that we know vaccination reduces the likelihood of post-COVID or long haul syndrome by over half. It clearly prevents you from dying. There's just no question about the importance of it. And there are some, and where there are some questions, we just have to go continue to study it and find out. My only thing, I want to follow up one thing. And Hawkeye, you probably have some insight about this. This stuff now that the Moderna vaccine may have a higher response rate, both because of a 4-week lag than a 3-week lag and a higher dose. Do you think that people who are immunocompromised should get a Moderna vaccine over Pfizer or J&J? And I don't know that I feel strongly about that at all, but I'm starting to hear that question get asked.
Yeah, there was 2 very good papers in MMWR that came out late last week, I think on Friday, looking at hospitalizations. One of them looked at Pfizer and Moderna, and the other one did as well. And one of them said that there may have been better efficacy against hospitalization, but the other one did not. I think it's a good, interesting data point, but I don't think it's really backed by now. I would still consider them really equal, and I think we need more studies on those. I'm not aware of any other particular studies that were looking at that, but also when you do look at that, you have to understand, what is the question? Are we protecting against hospitalization? Are we asking about vaccine efficacy against hospitalization or death? Or is it just testing positive for the virus? But reading through those 2 studies, both of them did state that vaccines continue to be very effective in preventing hospitalization and death. And again, those were released late last week in the CDC publication MMWR. So I'm not aware of any other ones that looked at that.
And so the other question I would just have was on the cancer patients. Do we treat them like transplant patients, where now the recommendation is 3 shots 1 month apart, for if you're on Moderna, for example? And do we wait 6 months, or should we just go ahead, because especially people getting active chemotherapy or who are under active treatment, then I wonder if it's not just you wait a month and then you get your next booster the following month. And I wonder if that's where we'll end up. And I don't know if you guys have thoughts on that.
I think we just have to do the studies. And, we've already talked about the fact that hematologic malignancy patients are kind of a special subset.
Yeah.
Because you're not dealing with a completely normal immune system. And so, the bets are off. We're operating in an environment where, we're trying to use the best information that we have. And I think the 3-dose regimen is a reasonable thing to do, and has clearly showed efficacy in terms of protecting people. Until we have better information, I think we should stick with that.
Yeah.
We've got Taylor Hemness on the line. Taylor, go ahead with your question.
Hi, guys. Good morning. On the topic of what you were just talking about, something that I wanted to ask you about this morning is I've had personal stories, and almost everyone that we've heard from that has a problem with a vaccine seems to have a story about someone in the medical community telling them why they shouldn't be taking the vaccine, whether it be a doctor of some sort or a nurse friend or a family member who used to be a surgeon. And there's lots of those stories, and I have heard them myself personally from friends as to why they had delayed in getting one. Are you seeing that being a trend? Is that pervasive of situations in which people from the medical community are telling people or encouraging people situations why they wouldn't get the vaccine, or is that overblown? What are you seeing or hearing about that being a reason why people are not getting the vaccine?
Yeah, I think that you can find anything you want to hear out there. And so everybody, but what we can tell you is that over 90% above of, if I took residents and physicians and combined that one, we know that about 90% of those folks have been vaccinated. So if that's the vote, right, if that's the vote, then 90% of the people believe in vaccination and 10% are reluctant. And there's no magical knowledge there. There is no hidden grail of information that's going to be showing you that, oh, vaccines are really evil and that there's this great conspiracy. There is no conspiracy. The only conspiracy is the one conducted by a coronavirus who keeps trying to mutate in order to find more ways to come get you. So if that's a conspiracy, then by God, there's a conspiracy. But otherwise, Hawkeye, no conspiracy. And my sense is that what you have to do is believe the overwhelming vote, as exemplified by the arms you see out there, just as Hawkeye and I put our arms out here on this program to get vaccinated from people in the medical profession. But vaccine reluctance will find a voice if it wants to hear one. And what you have to then try to decide is, okay, where are people really casting their vote here around the safety of these vaccines? And we continue to tout it. We've given over 100,000 doses here at KU. You know what? Folks aren't dying from the vaccine, people. They just aren't. There's a lot of stuff out there. Very few cases related to vaccine-induced thrombocytopenia, but and the rare blood clots, especially around the J&J and AstraZeneca vaccines. But that's an incredibly rare. What's not rare? COVID-19.
Yeah, absolutely. We saw that there are extremely rare instances when somebody truly has an issue where they can't take these new vaccines. One is a significant anaphylactic reaction to any of those components, and even in these, again, there's no preservatives in these. There's only 9 or 10 components, very, very minuscule amounts, or a significant adverse reaction to that first dose. But even if you had an adverse reaction to the first dose, what they have shown that even people who did have that at the second dose, there was less propensity to have those things. So if there still are physicians who or medical providers who are not recommending getting the vaccine, again, it's probably time to ask, where are you getting this information of, and maybe even switch doctors or medical teams, because we know the safety and the benefits of these vaccinations. But also take that with the qualifier that every individual does have their own individual health issues that we don't fully know about. I was just putting that in the broad context.
Yeah, there is no den of thieves here. There's no den of lies. There's no grail of people who are out there with sudden insight into truth. That does not exist.
Well, there was that study that came out a few months ago that showed that the vast majority of the anti-vax material on the internet is traceable to about 9 or 10 people. And there were a couple of medical professionals, quote unquote, in there, but none of them were infectious disease specialists. None of them had any particular training in vaccines or any of that kind of thing. And so, while you can find a few, folks that have opinions that are quite outside the range, it's the vast majority of informed, active medical professionals are solidly behind the vaccines.
Yeah, I think that's right. And just to kind of piggyback on your statement, Dr. Jensen, we know there are significant intentional misinformation campaigns out there to continue to sow division among any of our demographics within the United States. This is one more thing. So please just be wary of all that. And more importantly, look to prevent these tragedies that happen with this young Olathe East coach. Protect those in your community and yourself so that these things don't happen. And we know the vaccines do provide that protection.
98 to 99%
Yep.
of all deaths from COVID are in the unvaccinated population. 98 to 99%. There is no lie here.
Thank you for that. We're going to get outside here in just a minute and catch up with everyone who is going to be putting something inside that time capsule. But I want to just remind folks that this year we are commemorating 50 years of cancer research. So, Dr. Jensen, I want to ask you, just what does 50 years of effort put towards research and therapies to end cancer, what does that mean?
Sure. So the 50 year anniversary of the passage of the National Cancer Act is coming up in December. And this truly was a transformational event that happened back in 1971, signed by Richard Nixon, and the impact has been huge. In 1971, the 5-year survival rate from cancer was 49%, and now it's just under 70%. And that progress has largely come through kind of steady, incremental advances against this disease. And that's largely because cancer is many, many different diseases. And in fact, the more we know about it, almost every single cancer patient has a unique set of mutations that defines their own particular disease, so, which makes it a really tough foe to go up against. But we continue to make advances, and I think that the passage of that piece of legislation has proven to be a truly significant event, not only in terms of health care, but in terms of our entire country and its response to this terrible disease.
Yeah, in 50 years, and what a great year to bring in proton therapy here to our region. So we're really excited about that. Proton beam radiation is just an example of advancements made in cancer therapies. One way of marking time and progress, of course, with that is to bury a time capsule. And you're going to witness that this morning as we celebrate the Proton Center being built here at the health system. That will be going on outside. But first, let's go inside with a behind-the-scenes look of the Proton Therapy Center and what it will soon become. Here's Dr. Ronald Chen, Chair of Radiation Oncology. Take a look. Okay, Dr. Chen, I think I know you well by now, and we're heading to the vault, and I have a feeling that's one of your favorite places to show off.
Let me show it to you how it is today, and the way it's going to be in 8 months. It's going to be an incredible site.
All right, show me the path. Show me the way. I'm going to follow you. So, Dr. Chen, we've been inside this vault before, but for folks who haven't seen it, very cool. Just tell us a little bit about this room, what we're looking at, and then I want you to take us on a little tour.
Well, this is really exactly where the patients are going to be treated with proton therapy. And actually, the way this is today, you'll probably never see it like this ever again. The proton therapy project has been in planning for several years. There's been planning, there's been sort of construction, and finally bringing the machine here all the way from Europe and now under installation. So what we see here is where the proton treatment beam is going to come from. The protons are actually made behind the wall there, and then the little proton particles are fed through this beam. This is an incredible view that we have here. It's sort of this unfinished proton therapy unit. In about 8 months or so, this will be completely finished and look very pretty. But to be able to see this behind the scenes is an incredible opportunity today.
So this is what we won't really be seeing, but take us down some of these halls on what we will be able to see and what the experience might be like for a patient when they come here.
Absolutely. This is actually part of our current radiation oncology department. So what's going to be here in the future, this is actually going to be a checkout area for patients right here. We know that with proton therapy, we'll be treating kids with cancer. And so this will be an area that's dedicated for families, maybe parents and siblings, so they can wait together with the pediatric patients. Where we are here is actually going to be a new procedure room. This is the current limit of our department, and of course that part of the wall has come down, so that will make a connection with a new proton facility. This is where we are today, and I can't wait to show it to you again in the next few months.
It is now time to go outside to bury our time capsule. So to help us with this part of the story is a brand new member of our team. She may be a familiar face to you, or at least part of her face right now, Alexis Del Cid. Alexis, so happy to welcome you back to Kansas City. Just catch us up on the last few years since you were anchoring the morning news at KCTV5 and also hosting Better KC. Get us all caught up.
Oh, Jess, it's so good to be back. So I was at KCTV for many years. We left briefly where I was an anchor in San Antonio, Texas. And what can I say? We missed it. My husband, my son and I, my parents, we missed Kansas City so much. So we're all back. We came home and it's just wonderful to be back. We've been celebrating ever since we arrived last month. And you know what, Jess, speaking of celebrations, I want to talk about this time capsule that you have been discussing with the doctors all morning long. This is such a huge day. This is the time capsule right there. As you can see, it says time capsule on it. There's a hole that's in the process of being dug. So we're going to be getting to that in just a little bit. But first, I want to interview two very important people that have been just a huge part of this. We're going to start with Dr. Ronnie Rotondo. Dr. Rotondo is the medical director of the Proton Therapy Center. Dr. Rotondo, this is a game changer, particularly for children who are battling cancer. Can you explain why this is such a big deal?
Yes, thank you. So, proton therapy is the most advanced form of radiation therapy today, which really allows us to deliver the radiation in a much more focused and precise manner. That allows us to concentrate the radiation within the tumor and to really minimize radiation dose to the surrounding normal healthy tissue. So what that means for patients is a better quality of life and lower risk of side effects both during treatment and long term. Kids are particularly sensitive to the late effects of radiation, and so this is really a major game changer for them. For years we've had to send patients hundreds of miles away to get this advanced form of radiation therapy, and very soon we'll be able to offer it right here at home.
Oh my gosh, I mean, as if parents didn't have enough to deal with when a child has cancer. You can just send them down the hall as opposed to hundreds of miles away. What are you putting in the time capsule?
So I put in a few personal notes from when I first got here, outlining the reasons why we were building this and really the vision for our center.
Thank you, Dr. Rotondo. Now I want to talk to gentleman number two. We have Darren Kissler, who is the Senior Director of Radiation Oncology here. And you have been clinging to these items with a kung fu grip, until now. What are you putting in the time capsule?
So we have a lot of letters from staff that we sent around. The chiefs have been to 2 Super Bowls during this project. We have a lot of periodicals, Wall Street journals, and a lot of stuff about COVID. And as we think about when this time capsule will be opened in 30 years, we have face masks. And so it's really going to be a fun time to kind of go back and look. We also have a whole time lapse of the entire construction project from start to finish. Lots of floor plans and a lot of stuff about the technology that we're putting in the Proton Center.
Question for you. Who gets to dig this baby up afterwards, and how long is it going to be underground?
Well, it's 30 years from now, so I hope I'm not digging at my age, but we'll have some staff, and I think it would be great to have some patients that have received proton therapy and to be participating in that as well.
So the Proton Therapy Center opens up next year, which means there might be time to dig up the time capsule and put in a third Chiefs pennant.
That would be wonderful, and maybe some from the Royals and some from Sporting KC as well.
I love it. So we're going to get digging. Well, I'm not going to get digging, but we do have a crew over there. They're going to start burying the time capsule right now. Jess, I'm going to send it back to you in the studio, and then when we come back out, we're going to check on the progress of the time capsule. They've got a long way to go because this has to stay buried for 30 years, so they're going to have to dig deep for this, put all the goodies in the time capsule, and then later on in your show, we're going to check back.
All right,
back to you in the studio, Jess.
All right, Alexis, thanks. Great job. And get those guys to work. Get digging. All right, Alexis, thanks. We'll check in in just a few moments. We're going to get to pretty cool, though, huh?
It actually is really cool. When I think of time capsules, I'm just ready to fly. Let's go.
I know. I love that. I can't wait. All right, you got to stick around another 30 years, though.
I know.
You'll never retire.
Retire.
You're never going to retire.
The nurse I work with.
Okay, so let's get to some community questions. So Bridget wants to know, what is the optimal range of blood cell count for active chemo patients?
Well, that's an unanswerable question, I think, right off the top of our heads.
Yeah. I think what we're trying to say is that the white blood cell counts should come back to normal.
Okay. Is that normal for whatever your normal is, or is there across the board normal?
Yeah.
After chemotherapy. But if you have, in fact, a bone marrow cancer, who knows what it's going to come back to, right? So
exactly
it can be kind of goofy. But I think the key is, you're probably saying, I think the question, I'm going to reinterpret this question, is how long after chemotherapy am I still immunosuppressed around COVID? I think that's maybe it. That's probably a turn of phrase.
Yeah.
Let's explore that question for just a second. What do you think?
Yeah, that's a more precise question. I think probably if it was me, I probably wouldn't want to get vaccinated for probably 6 weeks after.
Yeah, and I think because you want to make sure you mount an immune response, but then how long before your immune system returns to normal, that entirely depends on the underlying malignancy and the type of chemotherapy you've had, I think.
Yeah, absolutely. We know the type of chemotherapy, the type of cancer, the type of immunosuppression is all very different for every individual patient. And I think to Roy's point as well, there was a pretty good article that got sent around by Dr. McGurk a couple weeks ago, looking at that in specific patients who receive certain chemotherapy, like rituximab, which actually takes out those B cells that make the antibodies. And so I think depending on, number one, the underlying disease, the total immunosuppressive regimen, you may not really be able to get vaccinated for 9 months just because we know that you will not mount that response. But all of those medical teams and those physicians that are prescribing that chemotherapy are really good at understanding those time frames and what they look like to come back to some sort of immunity.
Okay, so a couple questions about boosters. After mRNA and J&J, we were told that it would be a couple of weeks after the final dose before we are considered fully protected. Does the same go for boosters? Gail would like to know.
Yeah, I think the data on boosters is a little harder to interpret, but I would probably ride with that same thing. About a month, 4 weeks after that booster is when you can say, okay, I should have my whole immune system restored to my maximal level of protection. But the reality is that you're going to start seeing an effect pretty quickly, Hawkeye, because you've already got some level of from vaccine immunity already established. So I think that third shot, you're going to start seeing a response pretty quick.
Yeah, I would agree. I think you will pretty quick. I don't think they're going to change fully vaccinated to any time before that 2 weeks after that additional dosing, just because now it's standard. Now we know the protection you get when you are considered fully vaccinated, which is 2 weeks either from both doses of the mRNA vaccine or that single dose of Johnson.
And the booster stuff, still we need to see J&J's full data. Mm-hmm. I've not seen that yet. And then we have to continue to describe any potential differences between the three vaccines as to when you might actually need a booster, because that could be really confusing. It may not be the same timeline for each of those three vaccines.
Yeah.
Linda wants to know, when we get the booster shot, Moderna, should we expect to not feel well for 24 hours, kind of like we did the first round?
I think I would expect that, and if you do, that's great, but I would fully expect that you're not going to feel well for a day or two.
Ashley says, my 55 and 60-year-old parents refuse to get the vaccine, citing that there is no reason to get it since they are healthier than most people.
Yeah, that's not true. Okay, so here's the problem with that 55. Think about that 34-year-old coach. That should serve as an example. Plus, just to say, the median age of hospitalization here dropped down to the low 50s, around 50 to 52. So if you don't think you're vulnerable anywhere you're healthy, and remember, that's median, so that means half the people were younger than that. And they're not all super sick. COVID-19 can strike you if you're not vaccinated at any age. That's why you're seeing so many more children sick now and hospitalized. And even if you don't have to get hospitalized, remember, long-haul symptoms, long-haul COVID can occur in 25 to 50% of an unvaccinated population. That can be a potentially devastating disease that will last for a year or even permanently. Mm-hmm. Don't be that person. Really, it still astonishes me. We're not on this program every morning trying to tell you to get vaccinated and wear a mask. I had to bring that up. We haven't seen really said wear a mask yet. So vaccinated and wear a mask. We don't do this every morning just because we like to be on camera. Right? People say, are you enjoying being on camera? No, not really. I wish there was no need for this. I have a face made for radio, people. I do not want to be on camera every day, and I really think that what you need to understand from that is we're not here making it up.
Yeah, I would agree. I mean, that this is an argument that really hasn't held up. The argument of we are otherwise healthy. Again, early on, and especially now, we see that certainly the majority of people do not need to be hospitalized, but you are certainly rolling the dice and taking that risk because, just as you said, Steve, there are younger people overall in the average age that are coming into the hospital, and there are those groups and those people, even who are young and healthy, who do suffer severe disease and death. But even if you don't die or have to come to the hospital, you still run that risk of having those long COVID symptoms as well. And so really you're just kind of rolling the dice with your own health. In this instance, that we know that majority of that can be preventable.
And you made a good point. It's almost like we need to get some long haulers back on the show. I think they have quite an impact.
Let's have them talk about it because it's not pretty.
Hey guys, let the crew outside know with Alexis that we're going to answer a few more questions. Dr. Steins has to get scooching, and I want to make sure he's here to see that time capsule go into the ground. So we're going to ask a couple more questions. Okay, we talked about infertility, and Isaac, I wanted to know, can you just clear this up about the vaccine infertility rumor? He says, I thought it came about because there was something about the placenta and spike protein sharing some gene sequences.
Oh,
is that true?
It's just, you guys, just we have to let this go. There are a lot of vaccinated women who are having babies in our hospital right now because the vaccines have been around for long enough. There is clearly not, and when we can get our folks back down here from OB to answer some more questions, I think we need time to get Dr. Weinecke and others down here.
They're going to be on. She's going to be on this week.
Awesome, because here's the answer. There is just no impact on your fertility from getting vaccinated.
And yeah, we would certainly like to clarify, I think it was some sequence of 4 amino acids that were the same on the spike as a placental tissue. That has no bearing clinically on anything. We see a lot of similar sequences of amino acids in different proteins throughout our bodies, and also that may look like or be similar to other pathogens, but there is absolutely no correlation with that to clinical impact on infertility or anything like that.
And just to say, there are so many amino acids. There are only so many amino acid sequences we have to build as protein building blocks, because you're the basic science guy here.
Yeah, I mean, 4 amino acid similarity is nothing.
Yeah,
it's like you wouldn't even look at that twice. If you're trying to. Leverage that fact. It's just like, well, that'll never get anywhere.
Just think in this world, what's the vaccine equal to? Patrick Mahomes, okay? Bang. That ends the whole conversation.
All right, 2 questions. I need to ask you this, Dr. Steins. Melody says, how often do COVID patients receive lung transplant after COVID is negative, but their lungs are very damaged?
Oh, yeah, that's an incredibly rare event because you have to be otherwise healthy. There are some case reports of that happening, but it's very rare, and you have to be otherwise healthy to do it, and you have to have long-term damage to the lungs. So it has happened. There have been patients who do have it done, but it's incredibly rare when that occurs.
And will patients on ECMO ever get better?
The ECMO data is not great because in order to get to the point of being on ECMO, you have to have pretty severely impacted lung disease. The point of ECMO, though, is to really rest your lungs so we don't worsen the damage it caused, because when you have a lot of oxygen and you have a lot of pressure from a ventilator to push the air in and out, what happens is that the activity of the ventilator actually damages the lung too. So ECMO is a way to rest your lung. And then you hope for more healing. The ECMO data is not great. It probably can help 15 or 20% of patients, but the large majority of people, if you're so sick you need ECMO, things are not going to go very well.
All right.
I may be going out on a limb here, but I suspect every single one of those post-COVID lung transplant patients would rather have had a vaccine than a lung transplant.
That's possible because really vaccines you get a couple times. You don't have to be on immunosuppression the entire rest of your life and realize your life expectancy still is at most 10 or 15 years. And so, just get vaccinated.
I'm going to save, so we talked about infertility, the one I word, the other I word, ivermectin. I'll save that question for tomorrow. We'll dive into all of that. We get those questions every day. So I want to hold off on that today, and I want to send it back out to Alexis so that we can get that time capsule buried. Hey, what's going on out there?
Hey, Jess. Okay, here's the deal. It's going to have to be a ceremonial drop into the hole because they hit limestone, and Dr. Rotondo was convinced he could still dig through the limestone because he's been working out, but no, they have to go get an auger for that. So do you guys, who wants to do the honors of the ceremonial drop, and then they're going to come back with the auger, and then they're going to really bury it? There you go.
That looks good.
Don't worry.
All right.
We'll be digging that a lot deeper with the auger. We do also want to get some final thoughts. Dr. Rotondo, what are you thinking as you stand here on this day on such an historic event?
I'm just beyond excited, just to see this project come to life. It's been a incredible team that's been working tremendous hours to make this come to life. Incredible sense of pride for the health system, for our department, for Kansas City. The amazing members of our team and the amazing people that we've been able to recruit to our city to be part of this project and to really ensure we can deliver world-class proton therapy right here in Kansas City. Just an exciting day.
Darren Kissler, what are you thinking when you stand here today?
So I'm thinking, it'll be really fun to open the time capsule in 30 years, but really what's going to be important is reflecting back of all the thousands of patients' lives that have been saved because of this technology that's now in Kansas City. So we're really excited about that.
And just what a gift to these families that no longer have to drive hundreds of miles away or fly somewhere to get this treatment when a child is sick in particularly. Really a special day. Jess, going to send it back to you in the studio.
All right, thanks so much. Tell Dr. Rotondo we're looking forward. We will have the cameras rolling as he busts through that limestone. So we will get that on camera, and then we'll show it
They're
back
going to
here.
have the cameras rolling as you dig through the limestone, Dr. Rotondo. We're going to see you flex like the Incredible Hulk.
Oh, yeah. He's going to have to take off the white jacket for that one, for sure. Okay.
We'll send Hawkeye out to help.
That's right.
All right, I'll put that request in, too.
Perfect. All right, thanks so much, guys. We appreciate it. Dr. Jensen, final thoughts? Thanks so much for being on today.
If you missed a cancer screening because of COVID, please get that scheduled. It could save your life.
All right, great message. Dr. Hawkinson, final thoughts for you today.
Yeah, a lot of good information. We know that people are still concerned about Delta variant, maybe some of the other variants that may come up, Lambda, Mu, even some of the variants that we don't even know about yet. But I think we will continue to see the variants. But the best information and the best thing you can take away from that is even in these newest reports about time out from the full vaccination, you are still extremely well protected from having to go to the hospital, from having to go to the ICU with these current vaccinations. So please continue to encourage vaccination for those that have not yet gotten it.
Dr. Steins.
Hey, first of all, big shout out to Roy Jensen for all the great work he's done here in our hospital and our health system and the university for so long, both on the academic side, on the clinical side for cancer, and a big day coming up for you in that you submit the grant for renewal / comprehensive designation. Good luck. I believe you got it.
2 weeks from today.
I know you will. You're a good man. And I just want to say thanks to all of our listeners out there. Help us spread the gospel. 34-year-olds don't need to die from COVID-19. They just need to be vaccinated. They just need to be vaccinated. How much sadness has to occur because of denial? How much sadness has to occur? How much grief do we have to endure because people don't want to believe the truth? It's hard. It's hard.
We'll end on that. Thank you all for being with us today. Tomorrow, we're going to hear from an ICU pharmacist and a respiratory therapist about the current COVID surge and how it compares to this time last year. This team is simply put tired, they're worn out, what it's like caring for COVID positive patients now that we do have a vaccine available. So everyone, have a great Monday. We will see you back here tomorrow at 8.
Subscribe to our morning medical update and open mics with Dr. Steins podcasts. Now everywhere podcasts are available.